Welcome. My name is Michelle Hart. I'm the Director of Marketing and Communications at BostonSight. We thank you for joining us this Wednesday evening. I'm going to start off by sharing a brief overview of BostonSight and introducing our presenters tonight. I'll also share what you can expect from this webinar. So BostonSight was founded in 1992 as Boston Foundation for Sight. You might have heard BFS used to refer to us. Here in Needham, Massachusetts, there is an on-site clinic, a research team, an ISO-certified manufacturing lab, and an education team. Our vision is a world where no one suffers loss of sight from corneal irregularities or ocular surface diseases. And our mission is to improve quality of life by transforming the understanding, treatment, and care of the ocular surface. We want to transform that understanding not only with patients, but with caregivers and other practitioners. We share our research and care models so that everyone who needs a specialty lens anywhere, whether it is a PROSE device or a scleral lens, has access to that care. Now, I want to introduce our presenters tonight. Dr. Daniel Brox is BostonSight's Chief Medical Officer. He is a board-certified comprehensive ophthalmologist, and he specializes in the treatment of the cornea and external diseases. He received his BA and medical degree from Tufts University, and he completed his internal medicine internship at Mount Auburn Hospital of Harvard University. He completed his ophthalmology residency at Long Island Jewish North Shore Hospital System in Long Island, and he had an additional fellowship year of training at Mount Sinai Medical Center in Manhattan. There he studied the medical and surgical treatment of the cornea under one of the world's leading corneal surgeons, Dr. Penny Asbell. Darlene Riordan is the Director of Clinical Operations at BostonSight, and she's a certified ophthalmic technician. She's also a certified ophthalmic executive, which is the national standard for ophthalmic practice management. The CEO program recognizes those who have achieved the experience, knowledge, and skills identified by the National Board as essential to practice management. Darlene manages all clinic staff and operations at BostonSight. Michelle is our patient representative tonight. She has been a BostonSight PROSE patient for 5 years. She has blepharophimosis, which is a congenital anomaly where the eyelids are unable to open as far as usual and permanently cover part of the eyes. Michelle will talk more about her conditions, symptoms, and PROSE treatment. Here's a quick rundown of tonight's webinar. Dr. Brox will talk about what PROSE treatment is and its clinical indications. Michelle will share her personal experience with PROSE, how she discovered the treatment, her process in her life today, and Darlene will provide information about PROSE referrals, treatment and intake process, PROSE locations, and cost and insurance. We'll end with a question and answer session. Hey, again, welcome to all of you and to our presenters. Let's get started. I'm going to hand this over now to Dr. Brox for him to talk about PROSE treatment from a medical perspective.
All right, thank you, Michelle.
You're welcome.
So I'm going to go over a couple of things here, but just start with what is PROSE treatment in general. And PROSE stands for prosthetic replacement of the ocular surface ecosystem. And it's really referring to a treatment as a whole, not just the lens that we use as part of the treatment. And as we noted on the slide there, PROSE is really a comprehensive medical treatment where both an ophthalmologist that's trained in corneal diseases and external disease of the eyelids and around the eye works together with an optometrist who's fellowship trained in the BostonSight PROSE system, the BostonSight PROSE treatment. They work together in the clinic to address the medical needs and lens needs of the patient together. As well, the doctors will work together with your team at home or locally that you see for your regular eye care. That's always essential for the treatment to be effective, is to bring in the doctors that you're working with on a regular basis. When patients do come to see us, we do have an extended amount of time with patients. And so we're able to not just address the needs they have for the PROSE treatment, but also their general ophthalmic needs, and send over our recommendations of what could be done to make PROSE most successful for each individual patient. So PROSE devices are uh, about the size of a nickel. They're removable transparent domes that are made of a plastic that is gas permeable, which means it allows oxygen to move through the plastic itself. Back when these lenses were made originally, they were made out of glass and didn't even allow any oxygen to get to the eye, which proved to be not a usable product. But over time, the materials have grown and become better and better to allow more and more oxygen to permeate through these lenses to get to the eye to maintain the health of the eye while you're wearing these lenses. These devices rest on the sclera, the white part of the eye. That's really the key to them. They're filled with a saline every morning that is preservative free, and they jump over the edge of the cornea and the cornea itself. So they're not rubbing on that surface of the eye, that delicate cornea tissue, but rather being bathed in the moisture of the preservative free normal saline all day. And that preservative-free normal saline is really what does most of the magic here, most of the treatment here, is by providing that moisture chamber, that lubricated environment to the surface of the eye all day long. These lenses are just worn during the day, and then other treatments, other solutions, or medical lubricants are used overnight for most of our patients. These devices are FDA approved for therapeutic indications. These have quite a range, but in general, these are what we call ocular surface diseases, things such as dry eye disease being among the most common, or any disease that affects the surface of the eye, as well as what we call ectasia diseases or irregular cornea diseases, whether it be from injury, infections, or other surgeries that may have resulted in an irregular cornea. We'll talk just briefly about the anatomy of the PROSE device and scleral lenses. So these are two types of lenses, the PROSE device and scleral lenses, and they have very similar anatomy where the lens sits on the front of the eye, as we mentioned already, lands on the white part of the eye, the conjunctiva overlying the sclera, and jumps over the cornea. That area in between the back of the lens and the front of the cornea is filled with that preservative-free normal saline, as you can see here. That hydrates the eye all day long, as already mentioned, and it also protects the eye from external environmental factors, whether it be things in the air or even just the eyelids rubbing up and down against the eye itself. Sometimes the eyelids, especially the underside of the lid, can get a lot of scarring, which can be rubbing up and down on the eye all day long, and forming that protective barrier with the plastic lens can allow the surface to heal and improve the overall health of the eye. There's generally three indications that we use these lenses for, one of them being to promote ocular surface support, we say, or basically keep the surface of the eye healthier. That's one of our main indications. The other is to help promote comfort, to help relieve pain of the eye, is really the second important indication we use these lenses for. And lastly, we use them to try to achieve what we call the best corrected visual acuity. In other words, when the cornea is irregular, either from an injury or an infection or just from dryness, the moisture that is placed in the chamber will fill in the irregularities of the cornea. And by filling in those irregularities, we'll create an environment where there's a nice new smooth cornea, which is the lens, that will allow you to refract light and focus light much better. So those are generally the reasons we look to these lenses for our patients. So it becomes a little confusing with the terminology sometimes. So I just wanted to spend a second on that. A lot of the time people ask, which is best for me, PROSE or scleral lenses? Well, as I already mentioned, these lenses have very similar anatomy, how they sit on the eye. They're filled with preservative-free normal saline. They both are not touching the cornea or the edge of the cornea, which is a key to these lenses. But where they differ is really in the customization that you can do for these lenses and which types of diseases they're used for. Generally, PROSE is used for more complex diseases or more severe diseases. Some of the patients may have less severe dry eye, say mild to moderate dry eye, and a more simple commercial scleral lens may be appropriate. These scleral lenses can act similarly to how PROSE does, but they don't have as much customization available to them. There's not as many different adjustments you can make to them for each individual eye. With PROSE, you can do virtually limitless customizations to try to accommodate things like scar tissue or lumps or bumps or irregularities on the surface of the eye. So when we have an eye with a lot of scarring or different abnormalities of the lid or severity of dry eye is quite extreme, then we necessitate the PROSE treatment, which involves not only customizing the lenses, but also spending extended amount of time with patient, ensuring they're able to apply the lenses, remove the lenses, and use them on a day-to-day basis. So a lot of support in the other aspects of care, aside from just the fitting of the lens when you do a PROSE treatment. So this slide just emphasizes the points that I've already mentioned, that really those scleral lenses are more commercial devices that you can find in a private practice clinic or an optometry clinic locally and be able to treat like mild to moderate disease states of things like dry eye or mild to moderate irregularities of the cornea. And this is great. And one of the goals we have at BostonSight as well is increasing access to this type of technology for our patients so that people can get the different types of treatment they need. And they don't have to solely go to locations that provide PROSE treatment. PROSE treatment, again, is for those more complex or more severe diseases, and not everyone needs such high customization for those lenses. But for those people that do, that need that additional support or that additional customization, that's where PROSE treatment comes into play. So just to hit on some of the numbers here for PROSE efficacy, essentially how effective is the PROSE treatment for patients that it is appropriate for. We find that 96% of respondents from a 2024 survey said that the PROSE treatment improved their quality of life. 95% said it improved the vision and eye health. And 62% waited 3+ years for a referral. So that 62% is a low number. Is a high number. We want patients to not wait so long. So 62% of patients waiting over 3 years for a referral is something we want to change. In other words, when we see patients in the chair and they have such benefits from even having the lens on just for a trial in office, they'll often say, I wish I was referred sooner. And we're still seeing the amount of time it takes for referrals to come in, sometimes to take, as you see here, years and years before this is considered as a treatment option. So we do want doctors to be considering it earlier on for those diseases where it is appropriate, rather than having patients go through many, many years of different drops or different types of treatments that are less effective. So for the patients that have these types of irregularities and ocular surface disease, we want to try to get them in much sooner. And we're working with our colleagues in ophthalmology and optometry to help to do that. And lastly, these are the different types of disease states that we treat with PROSE treatment. And I won't read off all the numbers for you, but the general idea is if you find a disease on here that you are dealing with, that you can see the respondents as well, showed how effective the treatment was for them in terms of their eye health and their vision. And these are numbers certainly as doctors we're proud of, but it's certainly a privilege to be able to treat patients and to try to treat patients that are dealing with these disease states. And the treatment can be quite effective when used for those appropriate patients. So I'm going to pass things off to Michelle here. Michelle is going to speak about a condition called blepharophimosis syndrome, for which she was treated at our PROSE clinic. She can talk more to this and speak more to this, but blepharophimosis is a congenital anomaly, which is particularly focused on the eyelids, and essentially the eyelids not functioning properly as they should. And as they are not functioning properly, it results in exposure of the ocular surface, dry eye, corneal ulcers, eyelashes rubbing on the eye, or something called trichiasis. All of these things are obviously specific to blepharophimosis and her disease state and what she was treated for. But we can certainly say, and we know that many, many disease states that we treat at BostonSight result in the same endpoints, with exposure of the cornea, a dry eye, breakdown of the surface, corneal ulcers, and irritation from lid function, lid dysfunction, such as eyelashes rubbing on the eye. So although she'll be speaking about a very specific syndrome, I think it is very applicable to most of the patients that we see. I'll pass it off to you, Michelle.
Hey everybody. Thanks so much, Dr. Brox. My name is Michelle Wallace. I am a youngish woman with short black hair, or my hair's long, but it's up in a ponytail. And I'm in a gray blazer with a black and gold shirt on. And I'm so excited to talk to y'all a little bit about my experience with PROSE because it's been incredibly life-changing. Dr. Brox already talked to you a little bit about my syndrome, but I have blepharophimosis syndrome. So like Dr. Brock said, my eyelids don't are pretty low down. I don't blink quite as often as maybe other folks might. I have nystagmus and astigmatism, so my eyes are shaky and shaped a little bit differently than they typically would be. So all of these things go into effect with my eye health as far as causing really low vision, chronic dry eye, ulcers, a lot of discomfort, and low vision. And in 2020, right at the beginning of pandemic time, I started to develop a bunch of ulcers in my left eye. Um, and I was meeting with my eye doctors. I was going into Mass Eye and Ear, meeting with my cornea specialist. We were trying to figure out how to treat these ulcers, and kind of coming up with no good solution. It was incredibly painful. It was causing scarring. We tried a scleral lens, like Dr. Box talked about, as a first sort of attempt. And because of the shape of my eyes and the shapes of my corneas, it just wasn't working. And I actually ended up having a situation where I went to pull off the scleral lens and it caused a lot of pain for me. So sort of in a last ditch effort to treat these ulcers, I got referred out to BostonSight, which was like, I mean, I felt so awesome that I already lived in Massachusetts and BostonSight's right in Needham. So that was fantastic. But I started to work with BostonSight to get fitted and to try the scleral lens as a treatment towards these ulcers, and towards this chronic dry eye and towards these chronic infections. And it ended up actually not only giving me way more comfortable eye experience, but also a whole lot of sight, which was incredible. So what the process kind of was like for me was I started to go into Needham. It was also during the pandemic, so I don't know if some of the process is a little bit different now. But going into BostonSight, and I went through a bunch of what I would say were really cool eye tests that made me feel like a secret agent, like when secret agents hold their eye up to a door and it like unlocks. Scanned with a bunch of lights, all these sorts of different kinds of tests, all sorts of pictures of my eyes, really up close, which, was great for Halloween. Um, and started to get fitted for these pros. And almost right away, felt an immediate difference, even in the beginning. I think it took us about 8 or 9 tries to get exactly the right fit. But from the first fit, noticed incredibly improved eye comfort and incredibly improved vision, which was not even what I as a patient didn't expect improved vision, just was trying to treat these ulcers. And I remember when I could kind of see, and I was like, my mom came with me, even though I'm a grown up, and I was like reading things on the wall, and my mom was like, "How are you seeing that?" And I was like, "I don't know." um, and all of the doctors were so incredibly patient and helpful as I sort of was processing through that piece. Um, as I was getting fitted with these lenses, I also was getting really wonderful training on how to take them out and put them in on my own. I was given time in a room one-on-one, with someone who helped train me in utilizing the different sort of like plungers and things to take the lenses in and out. And having things near my eyes wasn't new for me. I put in my own eye drops and lubrication all the time, but learning how to get the lenses in without having a bubble in there or checking for bubbles, things like that were all a little bit of a learning curve that I had to come over. In addition to helping me do that one-on-one, they provided videos, written content, and even a little like swag bag of things I could take home so that I was starting with, all of the different cleaners, all of the things I needed to do that on my own. So that was really incredible. But yeah, it took us about, I think, like I said, 8 or 9 different sets of lenses till we got it perfect. But even the first set of lenses felt immediately better to me. And every time I came in and we tried a little bit of a different iteration, it was like, oh my God, I didn't even know it could get even better than that. So it's improved my life really significantly. I still have a really fond memory of in my earlier pairs feeling really surprised and confused about the vision and saying I need to go for a walk, and it was March. And March in Massachusetts is like the time that snow melts, but like buds aren't on the trees and like everything's kind of dirty and it's not the prettiest time to get your sight. And I remember I came back into the office a little bit frazzled, and I had Dr. Ashgari, who was my doctor, and she had said, "Hey, are you okay?" And I said, "I thought so many things are birds, but so many things are like trash and sticks and not birds." So something I like to tell folks as they're going through this treatment is it's like, if it's something that improves your sight and your comfort, right? Like to me, this has been an incredible life-changing thing. And there are parts of it that, even though it's this really incredible thing, might take a minute or take some adjusting or take, some time to get used to. I had to get used to seeing and get used to understanding what facial expressions meant when I had gone off audio for my whole life. And sometimes that was a little overwhelming. But folks at BostonSight were really supportive when I shared that, and even offered kind of like, hey, maybe you can go, watch a soap opera and see the faces that people are making so that you start to learn what that means, because people make really extreme faces in a soap opera or a Disney movie, right? And then I got to go down memory lane watching Disney movies. Um, so I like to offer that piece too, because like it's this really incredible thing, but it's also this big life change. And I felt really supported in that life change. Um, I think as far as just like my quality of life and what happened for me after, I went from being like very low vision to driving, which was an incredible freedom and life change, and not something that I ever thought would be in the realm of possibility for me. My eye infections have significantly decreased. In fact, I don't think I've had an eye infection since I've started PROSE, knock on wood. Always wash your hands before you put them in and out of your eyes. Pro tip. Um, my dryness and my ulcers has been significantly decreased. And so my overall eye comfort has increased. And I've done a bunch of traveling. I went to the Grand Canyon because I was like, I gotta see it. I need to see. So I've had all these really incredible opportunities kind of arise. And then I also continue to have touch points every 6 months or so with BostonSight to just check in and make sure lenses are working okay and everything looks like it's fitting properly and comfort is continuing and eye health is continuing. So I am continuing kind of that treatment piece. I think something too that Darlene will talk about that I meant to mention earlier is that folks at BostonSight also worked really closely with my insurance company to make sure, whatever could be covered was covered, and that they knew that this was an important treatment and all of those pieces as well. So I don't know as much about that. I know that it'll be talked about, but I will say as a patient, it was kind of a relief because it was going through this big, like, oh my God, I'm having these ulcers, and oh my God, I'm having this vision, like all these things. And then to have to not have to kind of fight and connect with insurance in different ways felt really helpful. So anyway, now I'm just kind of rambling. But these have been incredible, and I'm happy to answer any questions, or if there are pieces that I left out. Dr. Brox or Michelle, feel free to let me know, and I'm happy to keep talking.
Thank you, Michelle. I meant to mention to our attendees, please type any questions you have in the chat box or in the Q&A box. We can get to those questions later, or if I see them while one of our panelists is speaking, I can bring that up at that time as well. Michelle, I had a question. Do you mind sharing with us what size PROSE device you wear?
I don't know if I know the answer to that. I know that they're a little bit smaller.
Okay. Yeah, we
Um,
have there's a big range, right, dependent on the patient's eye. So I was just curious. And then you mentioned that you had been in, I think, a scleral lens before, so you had a little experience with applying and removing them. But how long does it take you in the morning now to get ready with your PROSE devices?
Oh my gosh, it's really quick. I think I put them in my eyes. I don't know. I think with cleaning and making sure everything's all set, probably about 30 seconds to a minute. Um, it becomes very like automatic almost. And I'll say too, something that took getting used to is like when they're in, I have really, really good vision, right? I'm like driving all these things. When they're out, I still have that really low vision, although it's gotten better because of these, but it's still pretty low. So each lens is marked with like little dots. So there's two dots on one lens and one dot on the other lens, and that tells you which eye the lens goes into. And I had trouble seeing those or like making out the difference in each one when my lenses weren't in. I was like, I need my lenses to see my lenses.
Mhm.
And the lab were able to darken those dots for me. And they've been darkened, when I've come back in and I'm like, hey, I can't see these anymore. So like folks have been really accommodating as I find challenges. But yeah, I probably put them in, I would say in under a minute. And I think that's actually giving more time than it takes. And then at night, take them out and go through the cleaning process and everything. Um,
All right, thank you. Like I said, please type any questions into the chat box. We are going to now have Darlene, our Director of Clinic Operations, explain a little bit more about the intake, well, the referral process and the intake process.
Oops, I'm sorry. I went too fast. I got a little aggressive there. Hello, everybody. As Michelle stated, my name is Darlene Reardon, and I am the Director of Clinical Operations here at BostonSight. Part of my role here is to oversee patient intake coordinators and the technician staff as well. And today I will be discussing how someone becomes a patient here at BostonSight and what the experience is like once they become one of our patients. So as we learned a little bit ago, 62% of patients waited 3 years for a referral. And as Dr. Brock said, we want to improve that. And so I want to talk a little bit about how you can advocate for yourself. And if you're interested in PROSE treatment, you might want to start by requesting a referral from your primary eye care provider or your corneal specialist. If they're unfamiliar with PROSE treatment, they can view our website to see what conditions PROSE treatment is helpful for. If your eye care provider would like to speak with us, we have a separate line dedicated to medical professional inquiries, as well as a physician referral hotline for urgent referrals. And if your provider is reluctant to refer you, you can reach out to us directly by emailing us at scheduling@bostonsight.org, or you can also call our main line to speak with an intake coordinator. So now I'm going to talk a little bit about how the referral process works. As I mentioned, some patients, or I would say probably most patients, are referred by their primary eye care provider or corneal specialist. Occasionally, they're referred by their oncologist or another non-eye care provider. Some patients are self-referred after a Google search for information on their diagnosis or through a Facebook group for people with their eye condition. Others find us through recommendations from a patient, friends, or other family members. And when a patient is referred, I did it again, I apologize. When a patient is referred by their eye care provider, they can complete this form, which is called a PROSE New Patient Referral Form. They can complete it and fax it over to our office. It's not required, but what it does is it provides a quick snapshot of the previous treatments that you've already had. Once that initial contact is made, whether by a patient or a provider, one of the intake coordinators will send the patient a packet to complete. We require demographic information as well as insurance information, along with medical forms to collect the medical and ocular history, past surgeries, and current medications that you're taking. The ocular history form is tailored to collect the past treatments the patients had for their eye condition. And we also require exam notes from a recent comprehensive examination, typically within 6 months, from your eye care provider or corneal specialist. And once all these forms are completed and we receive the exam notes, the patient is then ready for medical review. So every new patient is screened prior to scheduling a consultation. Either Dr. Brox or I will review the completed intake packet to make sure that a PROSE consultation would be appropriate for your diagnosis. So for someone with corneal surface irregularities, such as keratoconus, we would typically be looking for a failure with a type of hard lens. There's a few different types of scenarios there. One is called a rigid gas permeable lens. It's a corneal lens versus a scleral lens, as PROSE would be, or a scleral lens. As Dr. Brox mentioned, the cornea is a very sensitive area. These lenses sit on the cornea and they can be just intolerable and be very painful, or if the irregularity is pretty extreme, they just won't stay in the eye, and you'll hear patients say they just popped out. The other type of contact lens that many of our patients may have tried would be a hybrid lens, which is a soft lens on the outside and a hard lens in the center. Sometimes that can be more beneficial as far as, it might be less likely to pop out of the eye. But it might be more comfortable than the corneal lens, but the vision might be fluctuating, and they might also not be ideal for someone who suffers from dry eyes. For some patients, a hard lens failure isn't necessary due to the severity of their disease. And for the patients with ocular surface disease, we're looking for that they've tried and not responded to other dry eye treatments, such as lubricating drops, ointments, punctal plugs, cauterization, immunosuppressant medications, such as maybe Restasis or Cequa or Xiidra, or eye drops made from the patient's own blood serum. And the purpose of looking at these past medical treatments is to provide the medical necessity required by some insurance companies. PROSE treatment is expensive, and many of the insurance companies will cover it, at least partially, if other treatment options have been exhausted. And during medical review, the other thing we look at are contraindications, such as baseline corneal edema or swelling, topical steroid use multiple times a day, and the existence and location of tube shunts from previous glaucoma surgeries. If a patient is considered a candidate for consultation, I missed one part. The other part of medical review is we're going to actually look at how long the patient should be expected to stay, because a lot of our patients are traveling from far away. It requires hotel stays, possibly rental cars, things like that. So we want to make sure that all of that understanding is there. The next part, I'm stuck now.
You need me to forward it, Darlene?
Do you mind?
Not at all. Sometimes things happen. Let's see. There we go.
Okay, thank you.
Mhm.
If a patient is considered a candidate for a consultation, the chart will be sent to our insurance department, and our patient insurance coordinator will contact the insurance company to obtain a quote for coverage. The quote will then be reviewed with the patient. If a patient does not have insurance coverage or only partial insurance coverage, payment options, including an interest-free payment plan or the opportunity to apply for financial assistance, will be discussed. A financial application can be sent by email or regular mail if the patient wants to apply. And once the application, that financial assistance application is completed and submitted by the patient with all the required supporting documents, it's reviewed by the finance department, and the patient would be contacted for assistance eligibility. Patients that have been approved for 100% financial assistance will also be eligible for partial reimbursement for hotel, travel, and food purchases during treatment through BostonSight's Family Fund. Michelle, would you mind? Thank you. And as previously mentioned, patients can be at our clinic for several days. Usually treatment is completed within 4 to 5 days, but it can take 10 days or more. All patients start with a consultation on day 1 to see if they are in fact a candidate for PROSE treatment. If they are, and they wish to proceed, their PROSE treatment will start at the next visit. And the day of the start treatment begins with their provider applying their first set of custom PROSE devices. The next appointment, called a PROSE assessment, typically follows 2 to 3 hours later, when their provider will evaluate how the device is fitting, how the patient's comfort is, and how the vision, the comfort, and also how it looks. From there, the patient will go into training with one of our technicians to learn how to apply, remove, and care for their PROSE devices. Day 3 and beyond, we'll have a morning appointment with the doctor, followed by another application and removal training if it's needed, a 2 to 3 hour gap, and then a second PROSE assessment with the doctor again, and possibly an additional training before the patient departs for the day. Between appointments, patients can enjoy a cup of coffee or tea, along with a light snack in one of our waiting areas. And there are also a few restaurants just a short walk away. Our patients travel from across the United States, and there are occasional international patients, but most of our patients seen here are from the New England, New York, or New Jersey area. But those patients traveling from a distance, for those patients, we do have contracts with local hotels to help provide those patients with the best possible room rates. And Enterprise Rent-A-Car also provides our patients with a 5% discount with advance reservations. Michelle, would you mind again?
Yeah.
Thank you.
Yep.
Okay, as mentioned on the previous slide, patients begin training on how to apply and remove their PROSE devices on the first day of their PROSE treatment. The initial training, it begins with the patient viewing our videos on how to apply and remove their PROSE devices. They're given a copy of the PROSE device use and care guide, which reviews all aspects of application, removal, solutions, and storage. The PROSE application and removal videos are available to watch at any time. And the care guide is also available on our website. It provides links to purchase the solutions required online. And our BostonSight homepage will also alert patients to any solution shortages or recalls. So certainly important to stay on top of that and visit our website often. For some patients have never used a contact lens before, and PROSE devices are large and they can be intimidating. However, our seasoned technicians have helped hundreds of patients conquer challenges such as being able to keep their lids open wide enough to apply the device due to small lid openings or overcoming a strong blink reflex. Tools such as a plunger stand to hold the device while allowing the patient to use 2 hands to keep their lids open can be a game changer when it comes to successful device application. And challenges with fixating on the device due to poor vision can be improved with using a light for guidance. Each training is up to 45 minutes long, and patients can have 2 trainings a day during treatment. They're dispensed once they can show that they can apply their device without a bubble, as well as the ability to remove their devices easily. For some patients, this may take 1 training, especially if they've worn scleral lenses in the past, but they also might require multiple trainings over several days. But once that patient shows competency, they are thoroughly trained in the proper care of their devices. The PROSE devices must be removed daily, patients are instructed on solutions, how to clean them, overnight disinfection, as well as the appropriate solutions to rinse and fill their devices. Patients are provided a triage number and an email address for any questions that may arise. And discharge instructions advise their patients to follow up with their primary eye care provider, typically within 2 to 3 weeks of being dispensed. It reminds the patients that they have to continue to see their primary eye care provider for their comprehensive eye care. And they're also required to return to see us every 1 to 2 years or sooner if their provider requests for annual PROSE evaluations to ensure their devices are still fitting properly. Michelle,
Darlene, for our attendees who might not be familiar with scleral lenses, can you explain what a bubble is?
Yes. So prior to applying a device or a scleral lens, as Dr. Brox mentioned earlier, it is filled with a preservative-free saline. We train patients to overfill that device. And when that device goes into the eye, you want to make sure there will be some spillage of that solution. But the goal is not to spill too much. Because if we have solution that spills out, it is replaced by air. And if air is caught underneath that device, that can cause a dry spot and it can be very uncomfortable. So when that happens, the patients have to remove it and then try it again.
Yeah.
And now I want to talk a little bit about PROSE Network. Obviously, I've been talking a lot about how we do things at BostonSight, and things are probably done a little bit differently in the other sites. But in that initial phone call, when we speak with the patient, if there is a PROSE provider in a location close to them, we will offer that. There are 15 network sites at tertiary eye care centers in the United States, Canada, and India. And the PROSE providers at these sites are all PROSE fellowship trained eye doctors. Each PROSE network clinic is independently managed. So the cost for PROSE treatment will vary at each location. Insurance coverage will also vary, and that's due to contractual agreements with individual insurance companies. All the orders for the PROSE devices are manufactured here in our Needham, Mass location. So once an order is submitted, the device is manufactured and it's shipped to those clinics overnight by FedEx. The only clinic we're not manufacturing for is the PROSE Network clinic in India. They actually have their own PROSE manufacturing lab there, which is great. And then so for some patients, even though Needham might not be the closest location for them, it can be the best option due to family and work obligations. With our on-site manufacturing lab, device orders submitted by our treating providers, they're typically completed within 2 hours, which means that the doctors can order, multiple devices in one day if needed. So it can allow the treatment to be completed faster and the patient can return home sooner. And although, like I said, the process is probably a little bit different at the PROSE Network sites, no matter where you go, you can expect expert, compassionate care at all of the PROSE Network locations. So if you've been struggling with your vision or eye comfort and interested in learning more, you can find a PROSE provider. Michelle has the link up there on the screen there on our website, the Find a Provider. Please reach out to them for more information. And I hope that this was helpful, and I'm happy to answer any questions you might have.
Thank you, Darlene.
You're welcome.
Before we get to the Q&A, I just wanted to share with our attendees a couple quotes. So we have hundreds of testimonials and quotes from patients, which is, really wonderful. We love sharing the results that they have with PROSE. This patient said, before my PROSE, I was visually disabled because of multiple pops, ruptures, and corneal melts. My eyes continually burned from the neuropathy. The day I went into my PROSE was life-changing. My corrected vision is now 20/20 and 20/25, truly a miracle. And this patient said, after cornea transplant due to Fuchs dystrophy, right eye vision was 2400. After 10 months of trying various hybrid lenses that didn't work, I was referred to BFS, that's Boston Foundation for Sight, and received my first scleral lens in August '06. Resulting vision was 2015. After left eye transplant, went directly to the BFS, and with the lens, they said scleral lens, but that means PROSE device, was 2020 vision. Staff support services excellent, worth the daily routine care to have perfect vision with PROSE devices for 17 plus years. And we hear that a lot. The initial care might seem a little bit overwhelming, but kind of becomes second nature. And I have yet to meet a patient that has not found it to be worth it because of the wonderful results they've had. So I'm going to share some questions, and I just wanted to share my email address. Please feel free to reach out to me at mhart@bostonsight.org. After the webinar as well, it'll take a couple days, but we'll put this together along with the questions and answers that we had, and we'll email to all of you, so you'll have contact information that way to ask additional questions.
Michelle, if I could just add one quick thing.
Yes.
I've been trying to answer a few questions on the chat while we've been going
Oh,
along
thank
here.
you.
I
Okay.
just wanted to mention to those people that I think I've done it publicly, so I think you can all see the answers. It's under another account, but all those are answers coming from me. I think 5 questions that I've answered so far. But if you have additional follow-ups or questions, you can email Michelle or you can ask further questions on those points now as well.
And I just want to also say real quick, I realized after I had finished talking that when you asked about the size, my brain went beep boop and was like, it's gonna be a diameter number. Mine are like the size of a penny. I know that there are some that are bigger than that. I was a little intimidated about like, I'm putting this big thing in my eye, but it really genuinely, when we talk about it being like worth the care and worth the thing, like it has significantly changed my quality of life and my comfort and my vision. So they may look big and scary, but they are not scary. They're wonderful. So
No,
sorry
I
for
think
that weird answer
it's a good
earlier.
point. I know it's a good point about the size, and sometimes it gets it gets a lot of discussion always, and it can become intimidating for sure. But people often ask, and I think one of the questions in the chat was, what's the best size, or what makes for the best size, or how do you decide what's the best size? And there's a lot of factors that go into that. And when we talk about the anatomy and things like that, we're talking about a lens that lands on the white part of the eye, jumps over the edge of the cornea, which we call the limbus, and the cornea itself. And that's the key to any PROSE or scleral lens. And so, if we're treating a 3-year-old, a 14 millimeter lens may do the trick. And that's the most appropriate anatomically correct lens for that eye. If we're talking about a 43-year-old, it has various types of dry eye disease or scarring and things like that. Maybe something that needs a 20 millimeter lens to achieve the goals of comfort and supporting the surface of the eye and best vision. So it's just, what's right for each individual person. And because you have an 18 or someone else has a 22 or a 17, it's not really comparable. It's all about each individual's anatomy for what's best for them.
Thank you. So a couple questions. First, Robert, I apologize. It says the screen chat is disabled. It is. The Q&A, if you're able to, that is open for you to ask questions. A question, is it something to worry if you are rained on while you have the device? I guess probably a question about water.
Mhm. Yeah, I mean, it's a good question. So in general, we want to keep water out of away from the lens. And these are rules that I'll go through that are not specific to PROSE, believe it or not, or scleral lenses. They're actually specific to any lens, whether you have a friend that wears soft lenses or you wear soft lenses. These are rules that, believe it or not, you're probably told or should have been told when you started wearing even soft lenses for people. So we don't like to get pool water, or we don't like to swim with these lenses on, and that goes for any lens that goes in the eye. Just whether you're talking about pool water or lake or river or anywhere, ocean, there's certain bugs and things in there that if they get on the lens can result in serious infections. Even taking a shower, we say to take it off because there's little bugs called acanthamoeba that like to get on lenses and they cause very serious infections. So those are the rules for any type of lens. Rainwater is a real interesting wrinkle on that question. And so, no, we don't specify ever about rainwater or anything like that. We try to say, of course, try to keep things out of the eye, but you do the best you can with real world experiences. I think that'd be one of them where you do the best you can. And of course, you clean and disinfect the lens every night.
So how long can you safely wear the lenses each day, and how long do they last?
Yeah, I don't want to hog all the questions, but I guess I'll take that one too. But yes, so variable. So usually when patients get their PROSE lens, we say it will last you 1 to 2 years. It has a lot of ifs on that though, meaning that how well are we taking care of it on a day-to-day basis. That can really vary how long it will last. Some of the things are out of our control. Sometimes we'll get construction workers that work in a dusty environment with a lot of particulates, and their lens will get scratched up. And after a year or sometimes even sooner, they'll get so scratched up they have to replace them sooner. So sometimes the things that we're doing day to day can affect that as well. On the flip side, we have some patients that have been wearing the same lens for 5 to 7, 8, 9 years, and this lens still fits great and is in great condition. So, it does vary how long it will last. How long you can wear it on any given day, it varies as well. Your doctor should give you very specific recommendations on that for each individual person. For any lens in the eye, we like to avoid overwear that can be detrimental, meaning if you're wearing that lens 20 hours a day and take it off just a second before you go to bed and you only sleep 4 hours a night, you're getting too many hours of lens wear. The eye is not going to get enough oxygen overall. When that goes on for months and months and years, that's not healthy for the eye. But our average patients could be using 12, 14, 16 hours, something like that. Practically how many hours they need their functional vision for. And of course, we watch everyone's eyes closely to see how it responds. There are some patients with certain eye disorders that we have to very much limit their hours of wear. And some of our patients benefit, but unfortunately can only wear the lens for 2 hours a day. And that's just dependent on their particular eye condition.
You.
I
Oh,
in sort of adjusting and training with them and kind of getting fitted for the different lenses. I wear them usually probably pretty much around 10 to 12 hours a day. Um, Sometimes because I don't blink, they and like whatever, like they'll get debris underneath them and become a little bit blurry, in which I'll take them out and I'll go through kind of like the washing them routine and put them back in. And it did take me a little bit of time to start to get comfortable wearing them that long. So I started out wearing them like maybe 4 to 6 hours, and then I started wearing them 8 hours. And folks at BostonSight were really helpful in sort of coaching me and getting there. And the longer I get to wear them, the more thrilled I am because I get to see, and it's so cool.
wonderful. There was a question, is there a Boston site affiliate in the San Diego area or LA? There's not one in San Diego, but we have a site in LA at USC Roski Eye Institute at the Keck School of Medicine. That is in Los Angeles. So we're happy to share that information with you. This question's for Darlene. Does Medicare or Medicaid cover PROSE treatment?
Again, that depends on what location you're at. I can't say it is the same everywhere. Um, Typically, Medicaid, I don't think we've had it. Again, it depends on the insurance plan. Some people have a Medicaid through a Tufts plan, which would have different coverage than a straight, like say, Mass Health in Massachusetts. So that is such a question that is so there's no good answer to. And as far as Medicare, there can be some partial coverage. It does depend on diagnosis. And so again, it is something that you would want to ask specifically for your case. And it would, again, like I said, it would depend on, it might depend on where you're going as far as where you're getting your PROSE treatment.
This question is for Dan. Is PROSE effective for evaporative dry eye disease, MGD?
Yeah, so that's a good question, a specific question. People have dry eye for various reasons. Everyone on the chat here may not be familiar with the different types of dry eye, but one type is when the oil glands on the edge of the lid are not producing the part of the tears that keeps our tears on the eye for a long period of time. And when that oil layer is missing because the oil glands are not functioning properly or clogged, then the tears evaporate off the eye very quickly, and the eye dries very quickly and rapidly, and remains in that dry state throughout the day. And so that's a good question. So usually that type of dry eye can certainly benefit in comfort and supporting the surface of the eye and improved vision. So those three things that we get at. However, it certainly typically needs a concomitant treatment or treatment together with other modalities to try to improve the functionality of those oil glands or try to improve the tear quality. For one real main reason is the lens on the eye will, like I say, provide comfort and will support the surface of the eye. But now the eye is not getting dry because it has that moisture chamber, but the surface of the lens is now getting dry. You're not going to feel that, but that's going to start to make the vision fog throughout the day and perhaps have the need for you to remove the lens and reapply it and rehydrate the lens and things of that nature. So usually together with some additional treatments that we lay out with your primary eye care provider that's local, we try to get at that from a combination effort.
You. There's a question if we have a location in central or western Ohio. We have a location in Columbus, Ohio. That's at the Ohio State University Wexner Medical Center at the Havner Eye Institute. And again, we can share that information with you in a follow-up email. What are some of the considerations that go into choosing lens size for the diameter of the lens?
Yeah, so I think we spoke a little bit about that, but it is just very anatomic issue. How tight the lids are, how large the aperture is for the lids, how large the cornea is, and everybody is different in that respect. And what disease state we're treating, all go into that. So it's very, personalized and customized, and it is one of those things that I usually discourage patients from. I mean, it's good that they have discussions with friends or acquaintances or people online that are dealing with same diseases and have similar treatments to understand it. But I kind of discourage them from comparing like very specific parameters like diameter because sometimes it just gets to be that, oh, this number or that number is better or worse. And it's just not the case. And you want to discuss that certainly with your doctor, with your specific case. They can discuss those things, but it's really about what's best for your eye.
I'm going to do one more question because we're almost out of time. I know I haven't gotten to all of the questions. We will answer those again in an email. So thank you, everyone. But can you still use serum tears with PROSE devices?
Uh, Thank you for that question. I was actually in the middle of typing out that one. I didn't get to finish typing it, but it's a very good question. So as people ask about serum tears is a dry eye treatment when you actually draw your own blood. You don't. You go to a lab and you have your blood drawn, and that blood is then sent to another lab where they create eye drops out of the serum of your blood. Sometimes there's compounding pharmacies that do it all in one place for you. Sometimes there's places that come to your house to draw the blood, but the idea is that some of the nutrients and healing factors in your blood may help to heal the surface of the eye when applied on the eye. Some people use them twice a day, some people use them 10 times a day, but it's one of the basic dry eye treatments. That being said, it's a nutrient-rich liquid that is it very easily breeds bacterial growth in it. And so that's why when you get this treatment, they give you very tiny little vials, and all the ones that you're not using go in the freezer. And so one of the things we recommend is not using it with the lens. And what that means is not using the drop when the lens is on your eye and not using the drop in the lens, like to fill the reservoir, things like that. That's a medical opinion on that. You might hear other opinions on that as well, but the concern there is that you're creating kind of like a chamber filled with the serum, and that's going to be just a environment that's going to very a higher risk for bacterial growth and infection. So, and we have some patients that come in having done that, and we just don't see a dramatic difference in efficacy or ocular surface health from doing that either. So I think it has additional risk without additional benefit. But if people are on serum tears, we recommend, hey, put it in a couple times before you place your lens on the eye. In other words, put it in a couple times, wait 10, 15 minutes, put the lens on your eye. And then at night, when the lens comes off, you could put the drops in again, but not with the lens or in the lens.
All right, well, thank you, everyone. Our time is up. I appreciate everyone joining us tonight. Thank you to our panelists. And we will follow up with all of our attendees to answer the remaining questions. I know there were some questions around cost and such, and something specific around GVHD. We want to get to all of your questions, and just give us a few days and we'll get back to all of you. Thank you very much and have a good night.